How does sleep onset REM, SOMP, affect MSLT results? Imagine falling asleep during the day and suddenly entering REM sleep very quickly. That's what a sleep onset REM period, or SOMP, looks like. It usually happens within 15 minutes of falling asleep. Now, the Multiple Sleep Latency Test, or MSLT, measures how fast someone falls asleep during several scheduled naps and whether they enter REM sleep early. When SOMPs show up on the MSLT, it can really influence how doctors interpret the results. In cases of sleep apnea, especially obstructive sleep apnea, SOMPs can appear on the MSLT and make things confusing. Usually, SOMPs are linked to narcolepsy, a sleep disorder where people suddenly fall into REM sleep. But people with sleep apnea can also show 2 or more SOMPs during the test. About 4.7% of sleep apnea patients might have this pattern. Factors like being male, feeling very sleepy during the day, and having severe oxygen drops during sleep can make SOMPs more likely in sleep apnea. This suggests that severe sleep apnea can disrupt normal REM sleep patterns and cause early REM onset during naps. When SOMPs are seen on the MSLT in sleep apnea patients, it often reflects the sleep disruption caused by breathing problems and oxygen drops. These interruptions can mess with how REM sleep is normally regulated. So, early REM sleep during naps doesn't always mean narcolepsy. Instead, it might be a sign that sleep is very fragmented and oxygen levels are low. This makes diagnosing the cause of daytime sleepiness trickier, because the MSLT is used to tell apart narcolepsy from other sleep issues. Doctors need to look at the whole picture, including overnight sleep studies, oxygen levels, and other symptoms. If SOMPs are present in someone suspected of having sleep apnea, it's important not to jump to conclusions. They might be caused by the severity of sleep disruption rather than a primary REM sleep disorder. In fact, the presence of SOMPs in sleep apnea can be a sign of how severe the condition is, especially if oxygen levels drop a lot during sleep. To sum up, SOMPs on the MSLT can make it seem like someone has narcolepsy because they reduce the time it takes to fall asleep and enter REM sleep. But in sleep apnea, these early REM episodes often come from sleep fragmentation and oxygen deprivation. That's why it's essential to do a full sleep assessment, including overnight testing, and interpret the MSLT results carefully. This way, doctors can avoid misdiagnosing sleep apnea as narcolepsy and provide the right treatment.